I'm pleased to have Susan Graves. She's a Senior Solutions Advisor at Change Healthcare. Hello, Susan.
Hi, how are you, Dan? Nice to see you.
Price transparency starts to, play into this just a little bit, right?
I don't see that price transparency as a cost to the organization should be the responsibility, so to speak, of revenue cycle. I
Mhm.
mean, the organization can't exist without patients, and with payments from insurers, payments from patients, especially as patient payments is becoming almost 40% of the total cost coming in the door. They got to shift this whole idea of like it's rev cycle's problem. It's the hospital's problem. It's the health system's problem.
Right.
And when they say to, the challenge I get a lot is, oh my God, I didn't know it would cost that much. Maybe it costs a 300-bed hospital, let's say $150,000 a year to install and have a price transparency option that's complete, that does everything, bells and whistles, that they can use, that's going to be updated on a monthly basis. Any new contracts, you send them in, we'll push them in and make everything stay current. And I'm like, 150,000 to gain how many millions? Like, but it becomes RevCycle's responsibility to come up with the income for, budget for it. And I think, how could that not really be part of patient satisfaction? How could that not be part of the front, which is the hospitals? They know they need patient satisfaction to stay in business. If the patients aren't happy, they say the hospital sucks and no one goes there. So it's sad that it's sort of been forced on revenue cycle because they are dealing with the denials. But the reality is, it's a problem across the entire network that physicians, for example, are plagued with. If they're owned by the hospital and they have a check no matter what, sort of, well, who cares? Not my problem. I get my money either way, but that's not usually the case. I mean, there's always some margin or bonus or something tied to, in many cases, how successful the physicians are at performing their duties. I mean, whether it's because they get more patients because they're good, or whether it's because the payments are on time and they don't have huge denial problems. So to me, it's really an organizational issue. It is not the federal government didn't say RevCycle has to come up with price transparency. They said the hospital has to come up with price transparency, period. And they couldn't care less what department or team is responsible for it. It just has to get done. And it's because patients are complaining that they're paying bills after the fact. And in many cases, it's crippling them because they had no idea what it would cost for something. And it usually was something unforeseen. It usually was something, a cancer, some long hospital stay that was completely unplanned for. So it's unfortunate.
Are we going to find our nurses and physicians in a position where they're answering questions of how much this will cost, or are they going to always be needing to push the patient to speak to a financial advisor on the rev cycle
Yeah,
side?
I mean, they got to be aware of that issue. They have to be aware of the issue. And I think they are. The young ones are. I mean, I've talked to 3 or 4 docs that I know they are. I even asked, my internist the last time I was there, how she was dealing with it. And she was an older person who really wasn't dealing with price ever. What patients pay, don't pay, how they collect it, not her problem. But the younger ones out of school the last 10 years said they have to pay attention to ask the questions, because as they think about sending people for tests, as they think about giving them a prescription, like I said, they know these plans, these programs that are set up with the Walmarts and others, not just Walmart, others that say, we'll let them have this prescription for this problem for $4. And that is major to them, to not have to give them a prescription that's $860 a month. So they want the patients to get the drugs. We got enough, especially around mental health, we got enough people drifting around the streets of America that can't get the prescription drugs that they need, that it is our problem. Even if we don't have the problem, it will
Yeah.
become our problem if they're not treated, or feel like they have a place to go to get treatment. It's not getting any better.
Should our risk managers be connected to information about patients that we now, we know that they have a high deductible, they're at higher risk of not taking care of themselves, doing the right thing.
Well, I think if they
Yeah.
make it easy for themselves, they could just focus on right away. They could focus on self-pay, as far as patients that are either in Medicare because they're over 65, and we know they have all these limits on what they'll cover, pay for, et cetera, or they have no coverage at all because they're not working, or on some disability plan or something that's has minimal coverage. If they could just focus on how to deal with those patients to come up with not just this group of drugs that's $4, but maybe a location that provides certain services for minimal fees, set up a fixed fee kind of deal. And then you almost have to promote it. Like, who would know? If there's 10, 12 people that have mental health issues, who don't go to doctors, they don't have the money, how would they ever know? You see the commercials for every drug in the world. Every drug is on television. So, you see the COVID commercials, which are all, of course, all sponsored by New York City, by Nassau, by, the nonprofits. Well, if they had a program that was set and said, if you're having these issues, here are places you can go, you can get these services at this location, get those services, just promote it more marketing. I think that's the hard part, because how in the world would a patient know that they could go online and check how much it costs? How would a patient know that this service is provided at a reasonable, I can afford it, or they'll bill me kind of, cost at a reasonable cost? So it's got, some of it's just marketing and promotions, and I know there's many nonprofits out there. I mean, there's tons, but they have the same challenge. I spoke to a friend of mine, the CEO of a huge network in New York that provides, they have services, treatment, career planning, all those kinds of things for some of these housing situations in New York City, where there's 17 buildings and they have a center that people can go to get information about health, about everything. They are trying to get their arms around all the people who don't come in. They help the people who walk in, but how many people don't even know they're in there trying to help people? They're out there on the street and they're like, how do we get them in here? How do we pull them out of that building and get them into this center to see what's available? So if you take that tiny little center and then expand that across our country, look, it's a little scary.
Thank you for your time today.
Take care.
Have a wonderful day. Hey, thanks for listening. If you want more, be sure to click like or subscribe. If you'd like to appear on our program, be sure to fill out the SurveyMonkey below. Most important though, if you know someone who should hear this video, please forward it to them so that together we can all work to make healthcare just a little bit less risky.